In health news this morning, pelvic floor dysfunction is common in American women, with 25% in the United States suffering with at least one type of pelvic floor disorder. So what exactly is it and how can it be treated? Joining me this morning is Dr. Jason Bennett with Mercy Health Physician Partners. Good morning. Thanks so much for being here. So let's answer that first question. What is the pelvic floor?
The pelvic floor is actually kind of a neat organ. It's what supports the bladder, it's what supports the rectum. It's this muscular connective tissue that it's kind of this webbing that basically holds everything up.
All right, and when we talk about the disorders, they're kind of a couple extremes,
right?
When it comes to the disorders. So if you want to go ahead and run down the list, and we'll try to get some of those details up on the screen.
Well, things that people talk about are like urinary incontinence, like the need to run to the bathroom because you have urgency, or leaking with coughing, laughing, sneezing. But some other sinister more things are like fecal incontinence, where you lose stool. And it's a lot more common than people think. It's up to 10% of people over their age will actually develop fecal incontinence.
Is there something that brings this on? I mean, is it age? Is it giving birth? What types of things?
Yeah, I mean, it's a couple different things. Aging and menopause is a huge thing, and that's why it's so important now, because the baby boomers have all turned over age 50. So the age of people getting older right now is huge. People over age 60 is going to be 30% of our population in the next couple years. Wow.
All right. Well, I mean, obviously sometimes it's embarrassing.
It's usually so.
Yeah. So how do you go about treating, or what can be done?
There's actually a lot of different treatments. At Mercy Health, we've tried to design this continuum of treatments where basically we give you all the different options and let you decide what the best option, anywhere from conservative things like physical therapy, dietary changes, all the way up to surgical procedures.
Is there anything that can happen to you if you let it go untreated?
Sometimes it can be actually severe, where your kidneys stop functioning, or you can't go to the bathroom and empty your bladder or empty your bowels.
If I want to get some kind of screening or some kind of testing to see exactly what it is I'm suffering, and maybe this is what it might be, what happens?
I mean, the first thing is just, talking to your physician that you have the problem. There was a study done in Europe that looked at people that have urinary incontinence, and the sad thing is only half the people actually talk to their doctor when they have severe incontinence. And this is like you smell like urine, and you go through pads, you don't get out, you don't go to church anymore. So it's so embarrassing, people don't like to talk about it. But the first step really is just to talk to your doctor that you have it, and then they'll refer you to people like me that take care of those disorders.
And that's what people need to realize. There are people out there like you, trained for this very reason, and you're there to talk to.
Exactly.
Yeah. So some new treatment options that are out there, anything new and innovative when it comes to diagnosing this and treating it?
We've been involved in actually kind of some neat studies, anywhere from the Impressa, which is the tampon incontinence procedure, where basically you put a small tampon, it puts support against the urethra, and it's commercially available. We're involved in some studies where we actually take some muscle cells from your leg, we grow out a particular cell line, and we inject it in the urethra, and that actually helps stress incontinence. And then you don't have to worry about the issues with sling procedures that you've seen in the TV recently with mesh erosions and mesh problems.
Yes, and I was going to say, any type of side effect that comes along with this, or maybe you're taking care of that problem, but is it going to create other problems?
Not that we've seen. The success rates are actually pretty high, and you're using your own cells to fix yourself. So it's really kind of a cool thing. Yeah,
all right. Well, anything else you want to add on this? I think it's really fascinating that you guys are really able to study this and get some more advanced treatments in there for everybody.
Well, I think the nice thing is Mercy Health has really invested a lot into pelvic floor disorders, because not a lot of people treat it, and it's going to be higher incidence than people like with diabetes and back pain. Pelvic floor disorders, will be more people that have those disorders than everything else combined. So we're trying to actually develop a testing center that you can go in and have everything done to fix all these problems in one place.
Absolutely. All right, yeah, no reason to sit at home this summer and be embarrassed by something like this. I mean, help is out there for everybody.
It's better to get a better quality of life, and that's our goal.
Absolutely. All right, well, thank you so much for stopping by today.
Thank you very much.
Sure. To learn more, visit leakfreelife.com.